My name is Savannah Lodwick, and this is my comparative analysis presentation on Switzerland. Switzerland has one of the best universal healthcare systems in the world, and stands high in life expectancy and low in mortality rates. Switzerland has steady population growth and death, so their growth rate is just under 1%, making it an epitome of developed countries. There are three main geographic regions called the Swiss Alps, the Central Plateau, and the Jura, which all vastly vary in geology, thus creating a need for tailored healthcare based on local programs and not a national one. In Switzerland, all citizens are required to carry at least basic health insurance. This coverage includes things like primary care visits, vaccinations, OB/GYN care, and other basic healthcare needs. The health insurance of the nation is provided by the government through taxes and by regulating the requirement of insurance coverage for all. However, Swiss citizens pay for their own premiums, which can be expensive. Health insurance is compulsory, meaning that yourself and everyone in your family must have their own basic coverage, and this stands for any visitors that extend their stay for more than 3 months in the country. Hospitals in Switzerland are both publicly and privately owned, meaning that the government funds hospitals through Swiss tax dollars, or the hospitals are owned by individuals or groups of individuals. The doctors and staff work for the government in publicly owned hospitals, and they work for committees in privately owned hospitals. Training costs for physicians, like medical school, are individually funded by those who participate in the program. Physicians are then trained through hospital funding, which is either public through the government or private, and then physicians are also paid low salaries until they are fully trained, regardless of if it's a private or public hospital. Switzerland accounts for vacancies in medical positions by admitting, training, and providing jobs to immigrants. However, these positions are quite competitive. Despite the competitive nature of the field, physician shortages are real and happening more within the COVID age, so interventions should be created to alter this trend. The cost of healthcare in Switzerland, although the coverage is universal, varies. It varies based on your canton of residence. This system is in place because of different government funding across Switzerland, as well as different geological needs with Swiss citizens. In the case of healthcare expansion, the government would have a direct role in the matter, as it funds healthcare in Switzerland via taxes. Although the funding initially is from citizens, the government ultimately decides where this money is allotted to. Although Switzerland is known for their high-quality universal healthcare system, the prices are still quite expensive. However, since the quality of healthcare is so high, Switzerland has a very low mortality rate at 8.1 per 1,000 people, and a high life expectancy rate at 83.7 years, which is almost 5 years higher than the US life expectancy rate. Switzerland's vaccination rates are also high, at 60% for the COVID vaccination, as mandates, requirements, and availability are increasing, and these rates have been increasing every week. Despite there being no national programs for long-term care in Switzerland, there are many local programs. These programs work on the local level to provide more special care to those in long-term care. One of the progressive procedures in long-term care is that of assisted suicide, and this is an option in particular cases. This is also fully legal in Switzerland. Assisted suicide is the medical procedure of taking a medication and dying painlessly, opposed to months or years of suffering with that particular disease. The Swiss government spends about $66.7 billion on healthcare annually. This is about 12% of Switzerland's total gross domestic product. The individual cost is rather high as well, as an individual devotes about 10% of their salary on healthcare annually. The main issues with the Swiss healthcare system is that the costs of healthcare are very high, but this also goes with the high quality of healthcare seen in Switzerland. Another issue is a physician shortage, which it seems like every country is facing since COVID had begun. Another issue is finding a good doctor that someone feels comfortable with, which takes trial and error and can be expensive to carry out. The solutions to these issues begin at local interventions at the hands of the government in a country like Switzerland, where the government decides on healthcare needs, and these healthcare needs vary based on one's locality. Thank you for listening, and here are a list of my references.